on healthcare issues, and as a physician, I am very proud of what you do. Thank you.
Thanks very much. Well, good afternoon. I'll keep my remarks very brief. I've been up most of the night working. I'm still a practicing physician. I'm doing some hospitalist work last night, so I've actually done it for 3 nights in a row, so I'm pretty sleep deprived. But I also have a budget review work group upstairs that I have to get to. But I wanted to come today. I wanted to thank the Foundation for Healthy Kentucky for their efforts and for putting this this kickoff event together. I also want to thank a lot of our groups like the American Heart Association, the Smoke Free Coalition in our state, Chamber as well, all the groups that have kind of coalesced together to try to do things to advance the causes of tobacco-free schools in our state and trying to get a smoke-free workplace and a smoke-free Kentucky for the future. I think we all know how difficult this task is before us. I've often commented how policy in the realm of tobacco reform is probably the most difficult thing that I'll try to tackle as a legislator in my time here in the General Assembly. However, the day that we do get this legislation done, and it's going to get done at some point, and when I talk to my colleagues, even the opponents of this, I tell them it's going to happen, and they acknowledge that it will with time. It'll be an accomplishment with the largest health impact for our state, and that's why we have to keep chasing the prize as a group. I know sometimes it gets taxing, and we think, will we ever get this done? We've got to keep pressing forward. We all know what's at stake on this issue, and we've heard some of the statistics today. There's about 8,900 lives every year that are lost to tobacco-related illnesses. $1.9 billion in costs in healthcare when it comes to tobacco-related illnesses as well. It's the future physical health of our Commonwealth as well as the financial health of our Commonwealth. You know, our governor has been calling for much-needed tax reform and modernization of our tax system in the state of Kentucky. And I agree with him that it's time for Kentucky to finally spread its wings and flying. We've done a lot of things this past year as a General Assembly to try to attain that. We've done a lot of business investments for the state. We have people that are investing in Kentucky. And again, we've seen a lot of accomplishments. But the governor also has charged that everything will be on the table when it comes to this tax proposal. And so consequently, now is the time to start looking at proposals that by themselves maybe would not pass, but as part of a larger reform has a chance to become law. One of those worthy of consideration is obviously a tobacco tax for Kentucky. This measure, as we can see here to my left, would generate between $260 to $270 million in revenue, but will also help drive down our user rates across all demographics in the state. It would be a win for our physical health, again, a win for our financial health, and it also has the support of the public at large. I think we've seen so many of our polls that have been out there for people that want smoke-free workplaces, but also the consideration of a tax that makes common sense. When I talk to legislators in other states that are comparable to Kentucky, they've already done this in their state laws. So I would encourage you to prepare yourselves for the task at hand. We all know that it's not going to be easy. We must continue to drive the message in our communities and with our legislators. I think you can see that it's a message that has bipartisan support. It's not necessarily a Republican or Democrat thing. I think it's something that we need to know that for the benefit of the health and for our kids and for our future. We know that if we want other companies to invest, they're looking at things that are related to health-related problems. We've got to be a healthier state. God bless you all for your efforts. Keep up the good fight. And thank you for being here. And let's make sure we get this message out there. And we press forward. And I think we're going to see, hopefully, in the very near future that we'll get something like this accomplished. Thank you all. I'll let you introduce yourself, Dave. Absolutely.
Here to speak on behalf of Senator Alvarado. This is Dave Atkinson from the Chamber of Commerce. Really delighted to be here. Delighted to be talking about something other than pensions today. So thank you for assembling in Frankfort and allowing us to be part of it. I'm with the Kentucky Chamber of Commerce. We represent the interest of about 68,000 employers across the state. Employers are very concerned about healthcare costs. For business reasons. They get hit with insurance premium increases. They get hit with their tax bill. Kentucky employers pay about 40% of the taxes in the state, which helps fund things like Medicaid and other public health expenditures. And they also get hit with it in terms of loss of productivity when their employees are sick or less than at their top shape. So that's why I have said before that our smoking situation in Kentucky is not only killing us, it's bankrupting us. Businesses are finding it more difficult to compete in the international marketplace because of healthcare costs. So we have two priorities here today on behalf of the business community. One is to get a smoke-free bill passed for the state of Kentucky. We favor a consistent law across the state. And secondly, to increase the cost of cigarettes. The facts have already been delivered today. We agree that that is the best thing that could be done to discourage smoking. And by the way, employers didn't come to this decision because of the health implications, which is why most of you are probably in the room. They came at it from a cost situation. Clearly, it is not good for business to have a less than productive workforce and to have those kinds of insurance costs affecting us. You've heard some figures from the CDC. I'll mention a couple others. The CDC estimates it's costing us $2 billion in healthcare costs, $700 million of that going to Medicaid alone. And then in terms of loss to productivity, $2.7 billion. $2.7 billion that it's costing employers. So there's overwhelming support in the business community. Each year we do a survey of our members. Over 90% of our members support both of these measures. When we think about the cancer in Kentucky, Ben, you mentioned it, cancer, heart disease, etc. You all see it in your practices. These are things that we can do. We can do this as Kentuckians. We can improve the lives of our citizens by passing these two measures. So we're glad to lend our voice to the cause and glad to be a part of the coalition that's moving this forward. Thank you.
So, by request of the lady sitting in front of me, I would ask you guys to raise your signs for me, please. So,
By the way, I was to introduce Jacob. Jacob Stewart, listed on your program as Jason Stewart. That's incorrect. It's Jacob.
yeah, you see, it's going to be funny looking back on this. People are going to wonder, well, who is this kid? Because I've got, one paper it says Jacob Stewart with a T, and then another paper it says Jason Stewart. So I'm like, well, should I just stick with the T?
It's my fault, Jake. I am
It's okay, we all make mistakes. So.
Thank you.
So my name is Jacob Stewart, not Jason Stewart, and I'm representing Bourbon County High School SMAC Club. John Wayne, my favorite childhood movie star, was almost always seen with a cigar or a cigarette in his mouth or a gun in his hand, and sometimes both. John was always ready to fight for what he knew was right and take down any bad guy that he faced. Now, being a hyperactive 4-year-old, I would routinely find myself pumped full of energy and ready to take on John's role. As I played outside, I often found myself surrounded by tall tobacco plants. My grandparents had grown tobacco for years before I ever even existed, and they still grow it to this day. Growing tobacco was what their parents did, as did the parents of their parents. Tobacco is something that is undeniably ingrained in Kentucky's past, and is still putting up a fight for its right to exist today. One of my best friends, we'll call him Caleb, in elementary school, struggled with asthma and severe allergies. At first, I simply accepted it as normal, but I would soon realize Caleb's condition was, in large part, due to the toxic secondhand smoke that filled his townhouse. Even though my parents smoked, I was fortunate enough to be rarely exposed to secondhand smoke. Mom and Dad would always step outside whenever they smoked, and they never smoked in the car. After I learned the consequences of smoking and the harms of secondhand smoke, I found myself hiding their cigarettes. This was my first attempt to put a dent in the tobacco use crises. Addiction, that's the key to it all. When you use tobacco, the nicotine takes hold of you. As Cindy Still says, it's the smoker, it's not the smoker, it's the smoke. Significant increases in taxes on tobacco products is a simple yet effective solution to the problem. With a $1 tax increase per cigarette pack, a triple win scenario is created. First win, let's come back to Caleb. Sadly, Caleb's mother was one of the 20.4% of pregnant Kentuckian women who smoked during pregnancy. With a tax increase of $1 per pack, 5,900 infants who would likely find themselves in Caleb's shoes would be protected. Moreover, 23,200 Kentuckians under the age of 18 would not become addicted adult smokers, and we would see an 11.2% decrease in youth smokers. Less smokers means less money being spent on healthcare costs and would save Kentuckians approximately $15 million. Second win. The state would see $266 million in new revenue for the state budget within the first year after the $1 tax increase. This extra revenue could be critical to the state due to the current estimated shortfall of approximately $150 million. Lastly, this new tax would also boost the current job and business market. Businesses are less likely to move into an area where their employees cost the company extra money in healthcare costs. Even with tobacco's decline, my grandparents are financially stable from farming hay, livestock, mum cells, and others to make up for the decrease in tobacco. We call this diversification. Even my childhood hero, John Wayne, would later denounce smoking, running a series of public service announcements through the American Cancer Society. Caleb's asthma and early life struggles still follow him to this day. Increasing tobacco tax in Kentucky by $1 would create opportunities for the future of the Commonwealth. This state may have tobacco ingrained into its past, but with the introduction of this new tax, we can move past that and work towards a brighter future, thanks to the smoke clearing the air and the sun being able to shine. When you know better, you do better.